How the loss of a vaccine will impact vaccination efforts, however, remains to be seen.
Right now, it's kind of the battle between the variants and the vaccines. And we're sure hoping that the vaccines win.
That's the thinking of the medical community as Illinois opened vaccinations to everyone in the state 16 and older. It comes as the pool of variants is expanding, meaning those vaccines are being put to the test again.
The B.1.1.7 we had several of, and that's the dominant strain from what we're seeing now.
B.1.1.7, or the UK strain, is being identified across the state. It's not alone.
Most notably, the P1, the Brazilian variant, we had 16 positives there, and 15 of them were from the state of Illinois.
Dr. Aaron Rossi, CEO of Reditus Laboratories outside Peoria, says his lab recently identified 4 variants in Illinois. Among them,
we also saw the Santa Clara variant, the B427/429. That's the California variant that we've been closely watching. And those were basically clustered or, cluttered all over the state.
Those findings are no surprise to Dr. Mark Shelton, the chief clinical officer at HSHS.
It will not shock me at all to find the Brazilian or the LA or the South African variant show up in some of the data.
Dr. Shelton says this explains why infections and hospitalizations are up.
We know that the variant virus, COVID viruses are more contagious. And we know that a lot of people haven't gotten vaccinated yet.
So despite increases in hospitalizations, ICU and ventilator use are stable.
So we have not seen any real significant increase in the need or demand for ICU beds. We are seeing a slight increase in the need for our medical beds, but it hasn't been at all overwhelming.
I think that is almost entirely attributable to the high vaccine ratios in the people over 65.
Treatment has also improved for COVID patients.
When the first wave hit, the mortality was upwards of 25 to 30% in the hospitalized patients. And with improved care protocols, the proning, the changes in oxygen delivery models, the bamlanivimab, the remdesivir, the appropriate steroid use, all of those things, the answer is E, all of the above. They all contributed to improved mortality down to around 9 or 10%.
Additionally, Dr. Shelton says COVID is here to stay.
Everybody that's not been vaccinated or hasn't had COVID and recovered is going to ultimately get it one way or the other.
Carle Foundation President Lynn Barnes agrees.
We'll never squelch this, I don't think. It's probably a virus that's with us, but I think our science has really shown us that we'll be able to wrap our arms around it and keep it at bay.
Dr. Shelton does expect this 4th wave to materialize in Illinois, attributing it to the timing of spring break, increased travel, and students returning to the classroom and playing fields. He says with the variant's arrival and being more contagious, it'll impact the younger population more. And we are seeing an increase in hospitalizations across Illinois. More than 2,000 people have been admitted. The positivity rate has also increased to 5%. Nearly 3,200 new infections were announced, along with 17 more deaths. Also up, some good news, the number of people vaccinated across the state. More than 23% are fully inoculated, and more than 100,000 received a dose yesterday. The 7-day average in the state is almost 133,000.
Other news tonight, a third